Hi, I'm Crystal, and many of you know me as the lady at the Fibromyalgia Pain Chronicles. And while I do a lot of advocacy on behalf of the fibromyalgia community, I also do a lot of advocacy on behalf of veterans because I am a military veteran myself. One of the things I want to discuss today is the importance of setting an extra place or proverbial chair at the table for veterans for discussions surrounding healthcare, patient panels, patient advisory boards, healthcare organizations, and healthcare conferences. The reason being is there's this misconception in the United States that all veterans receive their health care through the VA, but this could not be further from the truth. There's anywhere between 18.2 million to 20 million veterans estimated alive in the United States, but on an annual basis, the VA provides healthcare services to only 9 million veterans. In addition, many veterans, including myself, do what I call hybrid healthcare. That is where we go to the VA for some of our healthcare services, but then go to the private sector of healthcare for the rest of our medical needs. In addition, of those 9 million veterans that are served annually at the VA, many veterans are outsourced under the VA Mission Act to private healthcare providers for a variety of reasons. Anywhere from needing to see a specialist for surgery, or maybe a veteran lives very far from a VA medical facility, so they're outsourced to a private healthcare provider that is closer to home. With that said, when you break down the numbers of all the veterans in the United States, more than 2/3 of veterans receive their health care in the private sector. One of the things that is interesting to me is that when looking at the private side of healthcare, healthcare discussions, patient panels, patient advisory boards, patient-driven organizations, and healthcare conferences, very few veterans are included in those discussions, which seems a bit odd considering so many veterans access private healthcare. We are now at a point where so many veterans are going to the private healthcare sector that it only makes sense to include them in these discussions and set an extra place at the table for veterans to join in on discussions related to healthcare, patient needs, patient-driven initiatives. The other thing is many veterans have a lot of insight on navigating policies and legislative issues, and their knowledge could be very useful at these discussions. Further, many veterans have a lot of insight on the systems that they had to go through in order to obtain the health care they needed for specialized conditions, everything from PTSD, traumatic brain injury, cancer, Gulf War illness, fibromyalgia, lupus, MS, just to name a few. A lot of times veterans have to really advocate for their healthcare needs, both at the VA and outside of the VA, and they gain a lot of knowledge that can be helpful to different patient-led discussions and healthcare-led discussions, whether it's in an organization or a medical entity or facility in the healthcare sector or healthcare conferences. The other thing about veterans and why they can bring a positive impact and attributes to discussions related to healthcare is if you were to put together any advocacy initiatives, veterans are very task oriented because of the training they received in the military, and they can be very integral in the success of any advocacy or awareness initiatives that any organization or patient-led initiative that's rolled out. And they can give you a lot of insight as far as policy and legislative advocacy as well for those type initiatives. The other thing about including veterans in healthcare discussions is one of the things that the VA has been doing really well with is developing healthcare that is more centered around female veterans and the LGBTQ community. In fact, some of the initiatives the VA has put forth are actually ahead of the initiatives in the private healthcare sector. And the veterans in these communities can provide a lot of insight, whether they sat on VA patient panels to review what is needed for female veterans and veterans of the LGBTQ community. They can also give you insight on what it's like being on the receiving end of those benefits, supports within the VA, and give you feedback on what's working and what's not. So when you're working in the private healthcare sector to improve the inclusion in healthcare medical services for women, for the LGBTQ community, Veterans Insight, who has been on the receiving end of those services at the VA, can give you some very valuable information. In addition, the VA has been very proactive in developing and promoting services, supports for people of color that have served our country. And again, these individuals can provide you a lot of information, whether they have sat on patient panels or were part of teams to improve the systematic services, treatments, and supports for people of color. And again, they can tell you what is working and what is not working, and that can be valuable and beneficial information for whatever initiatives that you are trying to put together and promote and incorporate within your organizations, healthcare medical facilities, health conferences, patient panels, and patient advisory boards. With that said, veterans should be included in patient discussion panels, healthcare conferences, patient-driven initiatives and organizations, because they not only have a lot of insight and valuable skill sets, but as I outlined earlier, the majority of military veterans in the U.S. are actually seeking medical treatment in the private healthcare sector. With that said, I want to leave you with one final quick thought, and that is, go Army! Hoo-yah! Army veteran here, representing the Army veteran community, but all veterans are fantastic. Love the Marines, Coast Guard, Navy, Air Force, and I have a lot of love and mad respect for every veteran that has helped me with any initiative, who have been a voice for our community, and I hope you join me in my next initiative in promoting veterans being included in mainstream healthcare and patient discussion panels, organizations, healthcare conferences, and legislative initiatives. If you found this video helpful, please like and share. And until next time, make your self-care your number one priority. Take care of yourselves, take care of each other. And until next time, ta-ta for now.